Hi guys, welcome back. It's me, okay? Dr. Tristan in the Anesthesia suite at Park Lane, where I do my regular MRI list. And so what I thought as we finish with the current patient on the table is I thought I would do a quick video on anesthesia for the MRI suite for children, just to maybe help parents and people understand exactly what it is that I do and to put your fears at ease. Okay, so guys, this is what we call remote site anesthesia. So you can see where I'm sitting currently. I'm not in the actual theater, okay, at all. I'm in the MRI, in the MRI suite, guys. And that's obviously because of the effects of magnetism, as well as the fact that it's bloody loud in there, and so we don't want to damage our hearing. So why do kids come for MRI scans? Well, generally it's the most common is that they've either had some sort of event at birth that requires follow-up, so they were premature, they had a hypoxic event, they had a seizure, or new onset seizures, and then, God forbid, the worst cases we see are the children with tumors. So the general sort of general anesthesia / sedation, well, what the medical aids in South Africa will pay for is up until the age of 8. But generally, I find up until the age of between 6 and 8, most kids can cope. The one thing that we need to keep in mind is that there's a subset of kids, especially ones that I do, and luckily I've doped them many, many times, some wonderful children who've come from overseas, etc., is you need to establish rapport, because they associate hospitals with sickness, with separation from their parents, especially their mother, as well as they are susceptible to the patient just came out of the suite and I got distracted. So the kids can develop PTSD, etc., so it's important to establish a rapport. And some of those, there's even a 12-year-old boy who gets so stressed out when he sees that MRI donut that he needs an anesthetic or sedation. So how do I generally do it? Well, I do the vast majority of my cases under very, very simple general anesthetic with a gas induction with sevoflurane and oxygen at 8% for 2 minutes. I then crank down that to 6%. I put up a drip. We put in a small breathing device called an LMA, and we leave the child to breathe spontaneously on their own with a little bit of oxygen and a tiny little bit of anesthetic gas. So remember, guys, I always say to parents, this is not a painful procedure. The only reason we're doing an anesthetic is they need to lie absolutely still so that the MRI machine can, take the pictures that it needs. So very simple, 30 minutes to an hour, depending on what they scan. No other meds, they just get fluid and a little bit of gas. For kids that are very small, under 10 kilos or neonates, as I told you in my peds talk, I don't leave those kids, breathing spontaneously, definitely not. The work of breathing is way too high. So I then, for those kids, will gas induce, put up a drip, or they'll come with a drip most of the time, and I will then use ketofol sedation in a 1-to-1 ratio. So 1 milligram of ketamine to 1 milligram of propofol. I give 1 ml per kilo. That will last 30 minutes. And then I give a 2nd ml per kilo for a second 30 minutes as needed. It wears off within 45 minutes. They don't get the hypersalivation from pure ketamine or the nystagmus, but they don't become apneic from pure propofol. So it's a great, simple recipe. And so, guys, what that means is that it's super safe, it's quick, and it's something that I, at least here at Park Lane Radiology Department, please search it. It is Dr. Shub's practice. Thank you to them and their support. Thank you to them for letting me film here. No patients are shown, so please don't worry about any POPI compliance or HPCSA compliance. So that's a quick rundown in the MRI suite, guys. It's a very quick anesthetic. It takes me a minute to get them to sleep. It takes me a minute to get them awake, and it's very, very gentle. So don't stress. Don't be concerned. The most common things that will happen is that sometimes as they go to sleep, they get confused, they get a bit scared, so they'll cry. I've never seen any child able to cry more than 5 breaths before my gas wins. I always say to parents, I'm sure you're jealous of this and you wish you could take it home with you for bedtime when they don't want to behave. So that's the one thing. The second thing that happens really often is that we put them to sleep really deeply, and then I wake them up quite quickly and they get hell of a confused. And I always say to parents, imagine it's you and you've had a really, really long day, and you have a nap and you wake up from that nap and you're like, oh my gosh, what is going on? That's how they feel, but they can't talk like that, so they freak out. So they get what we call emergence delirium. I'm going to do a quick talk on emergence delirium as well, part of the series. And what I've decided to do for parents, so please keep an eye out. Please like, share, and subscribe on all platforms, because I'm going to open up a series. So guys, as I was saying, the emergence delirium is very common, but it settles very quickly. And other than that, kids may sometimes have a little bit of nausea and vomiting afterwards, but it's rare. And some kids might have a sore throat, but again, it's rare. Okay, so parents, kids, families, caregivers, anaesthetists, everyone, it's a really safe thing. And the most important and critical thing that I cannot overemphasize is the team that you have in the MRI suite or in the remote side anesthesia suite. And so on Friday or Monday, Friday I'm doing peds cardiac surgery. Monday next week I'm doing MRI anesthesia in the remote site. And it's all about the team. So what I want to do is just introduce you quickly to them as they run away. This is Kamo over here. All right, say hello to Dr. Tristan's community. So this, I don't want my phone to get ripped out my hand, but if you look here, this is Mbali over there. These are the two, so these are radiographers, but they are now honorary, in my opinion, ultra qualified anesthetic nurses for what they do here. I often joke, can I go have coffee, and they'll just do the case. So guys, what we're gonna do on my live for next week, Wednesday, is we're gonna be recording an actual anesthetic. And you'll be able to see from a GoPro POV point of view what it looks like. So as I hold on here, there might be a bit of interference from the magnet. There's my anesthetic machine and my monitor, and there's the anesthetic machine and the MRI where the baby will lie. This is what it looks like. So once I put the patient to sleep, guys, this door gets closed, and then we sit here and watch the patient. And you can see through here, I then am able to observe all of the monitors and things as I need. So as we come across here, I just wanted to introduce you quickly to the rest of the team, okay? So this is Bilal, say hello to the Dr. Tristan community. This is Emily, say hello, all right. This is, say hello, Martha. This is Martha. Say hello, guys. This is the TikTok. This is the finance team. This is Lee, the first lady that I ever made contact with here, who booked me on my first list. And the rest is history. So thank you, guys. Please remember, thank you. Like, share, and subscribe, guys. It means so much to me. The impact that we're having on this community is incredible. And then last but by no means least, meet the most important lady in this practice. This is Tumi. She's the boss, my friend. And she is the one who was so kind to allow us to film this at all live. She's been running this anesthetic MRI team, and it has really been an amazing list. And I love these guys personally as well as professionally. And I really hope you enjoy this video, and that for parents, it helps to put your mind at ease. Who's on? About what? Oh, the scan. Oh. And then, guys, I'm about to start my list. We've just taken the adult off the table. And so we are going to now bring our first child in for an anesthetic. And I am going to ask them if they'll just quickly say hello to you. All right, guys, so I'm here with the parents of my first patient for the day. And she's just got a little message for you.
Hi, I'm Alexia De Freitas, and my son is coming for his first MRI.
Awesome. So guys, please have a look at this video, parents as well, and I hope you'll find it useful. Thank you.